The following podcast discusses topics about mental health struggles and illnesses, including depression, bipolar disorder, obsessive compulsive disorder, suicide, pregnancy, traumatic birth, postpartum psychosis, postpartum depression, and trauma. If you are sensitive to these topics or find them triggering, please continue listening with caution. If at any point the conversation is too much or you feel like you need to talk to someone, please know that help is available. You can call the Guam Behavioral Health and Wellness Center 24-hour crisis hotline at 647-8333 or the National Suicide Prevention Lifeline at 1-800-273-TALK or 1-800-273-8255.
Welcome to Everything's Cherry, a podcast for casual conversations about all things mental health related.
I'm Roselle.
And I'm CJ.
And on this podcast, we share personal stories, advice from professionals, and other musings on how everything and anything can affect our mental health.
Today we have a special guest with us, Dr. KristiAnna Whitman, who is a licensed professional counselor. Hey Doc, thanks for joining us.
Hi, CJ. Hi, Roselle. Thanks for having me. And for this conversation, you can just call me KristiAnna. It's fine.
Okay.
Yeah, so thank you again for joining us. Do you want to give a little bit of an introduction?
Sure. So my name is KristiAnna Santos Whitman. I am a licensed professional counselor and have been so for about 6 years maybe, but I've been in the field of mental health in different areas since 2004 when I graduated from college, and I think we'll talk a little bit more about that. But currently I do work at the Guam Behavioral Health and Wellness Center. I am the project director or manager of a suicide prevention grant, so I'm in the prevention side now. And I also do adjunct in the counseling program at the University of Guam. So yeah, that's my initial background and introduction.
Great. Do you think you can tell us a little bit about why you decided to go into this field?
Yeah, I was thinking about this when you guys sent me like the little, kind of the conversation starting points, and I feel like mental health in some way has always been sort of a part of my story or my life as a young, even though it wasn't something that was talked about in my family. I grew up on Guam and, typical, I think, Chamorro family, but I had some issues when I was going to school. So in a very primary, I don't even remember, I think it was like on and off. I had some attachment issues. I can't even really describe, but I had a very significant relationship with my school counselor. And I remember spending a lot of time in my school counselor's office. And so now that I know more about the field, I know that a lot of what she was doing was probably not in the realm or the typical realm of what a school counselor, would be. I mean, I really spent a lot of days in that office. And it was a lot of nurturing that she had done with me. I ended up loving school. I mean, obviously, I went on to get my PhD, so she must have done something right over the course of her time with me. But I always, when you think about what you want to do or what you want to be when you grow up, I always thought I wanted to do something in the realm of help and health. And I really thought I wanted to be a physician, a medical doctor. So all the way up until I went off to college in the mainland. I remember my first, I was at a pretty pretty prestigious competitive university, and in my first year, and I remember sitting in my Gen Chem class, and like hundreds of people, and there were people crying after an exam, and I was so like, even though I felt like I didn't do so well, maybe I wasn't crying. So I felt, and these people were crying because they felt like after that first exam in their first year in college, they weren't going to be eligible for med school, and I was like, oh crap, is that what it takes to go to med school? Like, I don't think I'm cut out for that kind of like, I'm not really a competitive person, to be honest. So it didn't sit right. And I had an elective, it was a psychology elective. And so this part I remember clearly, I was sitting on kind of a pre-med science major, and taking my psychology class and another larger class. It was like intro to psych, or general psych, whatever term that they used. And the lecture was about the human brain and how it drives love, and so it was like kind of putting this very like scientific information and equating it with something so intangible. And I was like, gosh, I think I need to be involved in that somehow. Like that's exciting to me. And these people are all kind of like, they seem nice. They don't seem all like, too competitive. So I ended up, I talked with my advisor in college and found myself with a psychology degree out of undergrad. Fast forward, I came home after, even though I kind of knew I wasn't ready. You can't really do so much in terms of employment with an undergraduate degree in psychology, unfortunately. But I was also in a relationship. And so I came home because I was, that was what worked for us at that point. Came back to Guam, and I was fortunate to have gotten my first job at then Department of Mental Health and Substance Abuse as a care coordinator, which is basically a social worker. And so at 21 years old, I was thrust into this world of Guam that I didn't know. I had no clue what that was about. I was going into these homes that didn't have proper infrastructure. I was, I kind of had a pretty good upbringing. My parents were, both my parents raised me, and that kind of thing. So it was a real eye opener for me. And these parents were asking me what to do for their kids. And I was like this young, naive, and I was like, oh my God, I don't know what to do. Like I was very, very clueless in terms of, I had my educational background, and that was kind of it. I was really missing a lot of like real world, like, this is what you got to do. So anyway, I knew I needed to go back to school and get additional training because I did want to be more effective at what I was doing. And so I found myself back to school and pursuing my master's degree in counseling because that's really what I wanted to. I knew that kind of getting resources, and I admire social workers 100,000%, and it's such an important part of the whole care coordination experience. But I knew that I wanted to like provide some form of treatment, I wanted to be that kind of therapeutic, whatever it was. So that's why I kind of went after my counseling degree. And then I was really interested in teaching. I've always been kind of enamored in that, field of education and being in a university setting. Again, kudos to that school counselor of mine who just made me love school so much. So I pursued my doctoral degree in Texas. And my degree was in counselor education and supervision. And I didn't know how diverse the whole program would be when I entered it, to be honest, but it really did provide me the best of all worlds in terms of, being able to get trained in clinical supervision, in providing the clinical counseling, and also in the teaching skills. So, so that's where I was. And then I've again, things happened and I came back to Guam and I haven't turned back since. I'm so happy to be home. I didn't think I was going to be back as soon as I did after I got my degree. I thought I'd be living in the mainland for a while, but I never felt more at peace with myself until I landed back on Guam as an adult, as a fully grown adult, not as the 21-year-old adult, but as the 31-year-old adult. I felt just so at peace being on Guam and being home and serving the community in some capacity.
That is really awesome. Thank you so much for sharing it. I think it's really inspiring to hear how you went from someone who had just a great relationship with a school counselor to now being a licensed professional counselor yourself and teaching college students and beyond. So that's really great. And I know you kind of spoke about it a little bit, but what do you do now?
So I am I think there's room to talk about this a little bit later, but I went through kind of a personal shift in the last 2 years. And so I love teaching. I always imagined myself retiring at a university and, if I had grandkids, them visiting me in my office. And I loved being at the university. That's where I always believe that I'll still end up there at some point again. But like I said, something personal occurred and I just needed a job change. So I kind of put feelers out. I was like, well, what's out there? I really didn't know. Like, being at the university and providing counselor education and supervision to counselors in training that's what I studied to do. Like that's where I wanted to be. And I didn't really know what else was, what other space was available. And so this opportunity came up. Guam Behavioral Health had just received a grant. They had received this grant in the past, but it is a prevention grant, really to prevent youth suicide on Guam. So really a focus on ages 10 to 24, youth and young adults. And one of our main things is in promoting training and resources for natural support. So this is a perfect example. People in our community who might not have professional or formal training in providing services, but still being comfortable talking about mental health and still being comfortable asking questions about suicide to the people they care about, and still really being open to this, awareness and helping to destigmatize getting help and receiving services or formal services. So that's one of one of the goals amongst others. But really, it's interesting because it's a youth grant, but I feel like I'm, you can't obviously help the youth unless the adults or the people in our community are willing and there to support those young people. So I find myself really pitching to my friend, the people that my networks over the youth. But so that's what I'm doing now. I'm in a prevention space, which is kind of is nice. I do have a taste. I was asked because I am licensed and I'm actually do meet the criteria for being a supervisor and in training up and coming clinicians who are seeking licensure. So I do have the opportunity to provide the direct service to counselors in training. So through them, I'm providing direct services. So I'm not doing individual counseling right now. And at some point I might, find myself doing that again. But for now, I always kind of knew, actually, I'll be honest, it was in my doctoral internship where I was working, during your internship, you're basically working full time. And I was in a very high need day treatment facility. And so it was that experience that kind of told me that I don't want to do this 40 hours a week. I don't want to see clients every day, all day. I needed to facilitate conversations at different levels. So, so yeah, anyway, I definitely don't ever see myself doing full-time therapy or full-time counseling as my job. So this is a nice feeler for now, being in that kind of space where you're preventing people from, getting, needing the assistance. Yeah.
So kind of to follow up on what you're talking about now, can you sort of talk about the current landscape in terms of what the community is like in regards to mental health and what some of the challenges might be when you're doing your education, your outreach with other people?
There's a couple of different things, right? There's I'll start with the cultural challenges, right? So we live in a space that's really and it's changing. And so, I think it's changing at least, but we live in a space where as youth, I'm pretty sure, I don't know how old you guys are, but, I don't know what the conversations you had at home, but I know we didn't talk about, mental health and feelings. And really, we were affectionate in my household, but not anyway, it's just not a common conversation. And so I know, we have this idea that, we take care of each other and we keep our stories within the household and, we don't necessarily, no one else needs to really know our business. And so I think that's the typical culture for a lot of people. Even in my multicultural counseling class that I teach, I do this survey with my students where we go through and we kind of discuss what was our relationship with various issues, religion, gender orientation, or sex, and sexual orientation, sexual relationships, faith or spirituality or religion, suicide, mental health. And in a class full of up and coming counselors, these are the people who are going to be the counselors in our community, there was one person in this class out of 15, 16, who said that she remembers, or it was a she at that time, yeah, that they remember having conversations with their parents about mental health in some way. And that was really eye-opening for me. I think maybe I kind of expected more people to have, be like, okay, so that's maybe what would lead you to the field, but it wasn't. And so I just, that's one thing. So I have a lot of responses to this. So that's one thing in terms of like kind of trying to jive with the culture, right? And how we try to do that, or we hope to do it, is by, we don't need to necessarily be at odds with each other, I think. And the field of counseling, the field of psychology, and I can share a little bit about the differences, but the field of counseling, because I'm a counselor, a professional counselor, really is striving to be a little bit more place-based and more culturally sound in practices, and really engaging in culturally appropriate strategies that really meet the needs of whatever community you're serving. At the same time, though, traditional mental health, you have these assessment tools that are based on Western principles. The idea of having a diagnosis is socially, that was socially constructed by people who were not Chamorro people, living on an island for sure. These are Western white men, who are putting these ideas of what's normal and what's abnormal out in the world, right? So, so there's that piece that we're kind of at odds with each other, right? And trying to figure out, like, how do you kind of balance that, or allow our cultural principles and our cultural values to integrate with our professional, or at least with I'm going to keep using with my professional beliefs and understandings, and allow it to be useful to the community, right? Because I think that's what happens. People are, we're afraid of things we don't understand, of course, and we're afraid of labels that we only understood from a negative connotation, someone's going to tell you you're bipolar, right? We try not to even use that phrasing anymore. We should say, someone who's been diagnosed with bipolar disorder, but automatically, they're bipolar, I'm crazy, you're crazy. And there's all this connotation that goes along with that. And so, how do you kind of manage that and make it something that's translatable for the community that you're serving? It's not an easy thing, especially when you're working in a system. And for me right now, I do work in a system, and there are standards that we practice that are based on cultures that are not local, local cultures. And we can get creative about things, and we really do. I think we try to, and different clinicians really try harder than others, probably just because of their own grounding and understanding and personal beliefs and experiences. But it's still, it's still a difficult thing. The last thing I'll say is, over the last year, this podcast, I think, is a testament to it. Over the last year, this pandemic has really allowed us to really have these conversations about mental health, because I think even the person who thought they were the most whole and balanced in their life, maybe started to lose a little bit over the last year, and has been really challenged, and things that made us happy in the past maybe aren't making it, aren't doing it for us anymore. And that that kind of forces us to question, are we doing okay? Am I doing okay? And so that's been really, I keep telling people, I'm like, man, or people in the field, coworkers, I was like, this is our time to really harness all of that and use it in a really positive way. And, we use that word, what is it? Amplify, right? We amplify it, but really do amplify the voices of, I don't want to say the voices of mental health professionals necessarily. I have a second piece to this, but the voices of those people who are like going through the experiences, what is that experience like? And what is it like to be at the end where you are feeling that, like, I can't speak out because someone might think less of me, or I might not be capable at doing whatever it is I need to be doing because I've been diagnosed, or I've been told that I'm this and this is what it is. So with that said, I think that's it's a really kind of important time in the field of mental health right now, because there's a lot of power in what's said. So I say that, and this is a good segue to my last, I want to make sure that I do hone in on this, is because there are, I think Guam's a small community, and there's a lot of different people who are bringing about mental health issues or wellness issues, or and making that kind of the subject of whatever it is they're doing, like this podcast, right, for example. And that's great. At the same time, we also need to be gentle with the people we're serving or trying to reach, and recognize that some of them are really, really vulnerable and might misconstrue some of the messages that they're receiving. And so, especially for those who are practicing things for money too, just recognizing that you do, even if there isn't some sort of board or some sort of certification you need to receive to do certain things, also kind of knowing like what kind of power you have through social media platforms and through blogs and through media. I know you mentioned that other media or maybe even media professionals and how things are construed in popular culture, right? So just being responsible about that, I think it's really important. And on the other side, like for those who are seeking services, there's nothing wrong with asking, especially if it's for a fee for service, what is your background? Have you ever worked with someone like me before? Have you, and knowing that you have a choice. I mean, the choices may not be very vast here on Guam, but there still is a choice, and so, yeah, I guess, yeah. So I think recognizing that and knowing that there is something to be said about someone who is licensed and has gone to like certain amounts of school and has had certain amounts of like supervised experience, and then there's also a space for other people who are practicing different things, right? But knowing what you're practicing and knowing what you're choosing, I guess, is one of the things I think is an area that I think is going to become a little bit more of an issue in the future years, as and I think that always happens, right? When something becomes amplified, right? There's more people kind of interested in it. And so then you kind of have to start like thinking, okay, well, what's that? Like, how do you sift through all this information now? Like, and yeah, and I can ramble about that, but I'll pause there.
Yeah, I think everything you said is so, so important. And so we really are grateful to have you and your voice here, as well as the connections we've been able to make with Peace as a whole. So this is kind of just a short form question, but, if we have other art makers or people who want to advocate for mental health listening in today, what resources would you recommend to ensure that the messages that they're providing are, safe? Is there any resources?
Yeah, that's great question. So there are tons of there's and I think I shared with Roselle, like, for example, with suicide is where the space that I practice in right now. And so there's Suicide Prevention Resource Center, which has a host of free technical guides, which again, it might be overwhelming for the person who's just looking at it for the first time. But so Peace, which is the Prevention and Education or Prevention and Training Division, which I work under, stands for Prevention, Education, and Community Empowerment. And one of the missions or really guiding principles of the division is to provide that kind of technical assistance to those who are aligned with the mission, which is a healthy community, right? And that's really what we're hoping for. So you can definitely, and I can give you my contact for you to share, in terms of emailing me or contacting the Peace office if you do require or need some technical assistance. In terms, and then there's general places. I think you can typically tell what's kind of legitimate information versus what's not, when you look through websites and stuff. But if someone were to contact me, I'd be happy to lead them in the right direction, at least for locally, even nationally. And then there are other organizations on Guam, the National Association of Social Workers or or Guam Association of Social Workers just had their big conference. And they're a very organized group of social workers who I'm sure can provide technical assistance to anyone interested. There's the Association of Individual Marriage and Family Therapists, which I'm also a member of. And that is also a group of, clinicians who get together and consult, and we're happy to, spread the love. And then there's the Guam Psychological Association. So there are a couple of groups that are kind of organized locally that I'm sure would be happy to partner with others who are interested.
And just as an example, can you give an example of like something that like a problematic statement that and like what the more correct statement would be in terms of
Yeah, so we talked about that. Yeah, we can use our example, right, Roselle? If that's
yeah.
okay. Are you? Yeah.
Yeah,
So,
no problem.
so I know Roselle because she actually we contracted her. We, meaning my grant, contracted her to produce a short film on the subject of suicide. And so when she gave me the first draft, there was the statement of, I don't even remember the exact verbiage, but it said, commit suicide. And that's a very
Yeah.
common way of talking about someone who has died by suicide. And we really, it's very common again, but we really try to avoid that because, when you say someone has committed something, it means they've done something bad. They've committed a crime, they're committed to a mental health institution, and we even try not to say that either, like, because it's involuntary, it's something that you're not, you're like, it sounds very moralistically bad. I don't know if I made up a word, but, so just, so it's judgmental is basically the thing. And what we really want to avoid again is that judgment, right? We don't know what's going on with the individual who has died by suicide. We don't know what kind of issues they were experiencing that led them to that space. And so to automatically penalize them and without them having a way of speaking up right after the fact is just, it doesn't, and then it also, the other thing is it stigmatizes those who might have either lived experience meaning, have had their own thoughts of suicide, or those who are survivors of suicide, like someone who has lost someone by suicide. It makes them feel like the people that they love or the experiences that they had were bad. And so why would anyone want to talk to me about it? Or why should I need help if I'm in the wrong, right? So, so that's kind of one of the things. The other thing I mentioned earlier, and again, I think as a community, we're getting a lot better, but I still hear it, is like, oh yeah, she's ADHD or she's bipolar, and she is not. I mean, she's CJ and she's Roselle. Not that you have, you've been diagnosed with either of those, but we're a person first versus over the diagnosis. Diagnoses can change, and there's, I mean, we try to be as good about it as clinicians as possible in terms of doing our due diligence and getting all the information to make a proper assessment, but like anything else, we can be wrong, and so you've placed this identity on someone, and it's just another person doing that to another person, and that just doesn't.
Right. And I did. Sorry, I didn't want to interrupt you, but like, I also grew up in a space where like people were using those words, even though it didn't necessarily mean anything. Like, I have a friend who also works in the field of psychology, and she said that she's had people come in to their office like thinking that there was something wrong with them because people were throwing those words around when it didn't mean anything, right? There was nothing like wrong, like not that there's anything wrong with somebody who's diagnosed with bipolar disorder, but like, they didn't have anything, going on with them that would have warranted somebody to say, oh, you're so bipolar. They were just,
Another one, and this one really drives me a little bit off, it kind of dysregulates me when I see it, is, kind of making something feel less than, like OCD is a very common,
yes, that's my biggest
obviously I don't have OCD tendencies because my room is a mess, but, but that's not it. That's not what it is. Right. And, and I'll say it, we like loosely also, but use it so loosely, and so casually, as if the people who actually have, experienced those compulsions and obsessions don't go through the hardest days and, don't really struggle with that. So, so again, it takes a lot of education, but it also, not only education, but it takes being conscientious about us. I mentioned that I just got out of a training, and we talked a lot about language, and I was in this training, and I was like, wow, okay, why are we spending so much time talking about language? But it's just so important because that's how we communicate, and that's what that's how we have we absorb messages, right, about who we are and how we are expected to be in the world. And so, our language, the words we use are so powerful. And so again, being really intentional about that.
Right. And I completely agree. Language is so important. And I think in the past few years, we've had so much conversations about the different kinds of words we should say. And I'm really glad to see that that's now entering the mental health field, where we're talking about, hey, maybe we need to rephrase things. And I do just want to do a little plug in regards to learning about the things like how to talk about suicide. I was able to take the assist training through Peace, through the organization you work for, and that's where I got to spend 2 days learning about these things. And so if you're listening today and you're curious about how you can learn to be a better ally and be a better advocate when Peace starts to open up trainings again, I highly recommend them. Will they be opening up soon as we start to open up?
Yes. So a couple of different things, and I'm going to plug for the whole organization as a whole, because Guam Behavioral Health also, as a larger organization, has a bunch of trainings. And I think May is, I don't want to do more than I don't know when this is going to go out, so I don't want to jump on anyone's promos, but I think May is going to be busy with regards to Mental Health Month. And I think everyone's just feeling like they need resources and they need support, and hopefully things are safe enough to have some form of safe in-person trainings, even in small groups. But yes, so there are different opportunities. Mental health first aid is also a training that is not necessarily run out of the prevention and training division, but is also offered through Guam Behavioral Health. And there is an adult mental health first aid, there's a youth mental health first aid, and there's actually going to be, during the pandemic, I got trained in teen mental health first aid, which I don't know when we'll be able to provide that training, but that's a training, that's part of the suite that's unique and supposed to be delivered in the school. So hopefully in the next year, we're trying to partner with DOE. There were DOE trainers who were also involved, but hopefully soon we get to roll that out in the schools. But both the adult and the youth mental health first aid are great. Overall, it's supposed to be basic first aid, right? CPR and basic life skills for mental health issues. So it's really cool. But and then we have the Living Work Suite, which you mentioned. Assist is the most people really know about Assist because it is the most intense, probably, and the most powerful and the most time consuming. It's 2 days, 2 full days of really immersing yourself in difficult content, and so that's the most intense. We do hope to get those going again. Safe Talk is part of that same suite, which is short, and it's about 4 hours, and really does prepare you to kind of be able to ask the questions, right? And then we have, which was actually as a result of the pandemic, which was the most brief and basic, kind of just get you oriented and feeling a little bit more comfortable and confident about what to do, is the Living Work Start training, which we are actively offering, and that is about 60 to 90 minutes virtual. It's fairly interactive for what it is, but we can offer that to everyone on Guam for free whenever you're ready. If you have an hour to spare, it's pretty easy to use, and you can stop and start again at your leisure. So those are kind of the main trainings that we're kind of pushing. There are some new things coming out, again, these virtual platforms make it really, it's been a blessing and a curse, because, I miss in person, but we have had, it's not as costly now that we don't need to go off island anymore to get trained in certain things. So the training I just had overnight was actually specific to clinicians providing safer suicide care in the outpatient setting. So what we don't realize, what probably no one really realizes, that, so even though we get trained in all these counseling skills and, in our graduate programs, there really isn't a course dedicated to crisis management and suicide care, and there's a huge, even in healthcare systems, there's just this huge break between the formal hospital setting or our outpatient or primary healthcare providers and the mental health systems, and so what we see with regards to people who do die by suicide is most people have made some form of visit to their primary care doctor, have gone to the hospital. It may not be something that they're manifesting with, through a mental illness. It might be somatic, but, the ER doctors or whoever they see at the hospital may not be trained or may not be screening for some of these other things. And so, those were opportunities that we missed as healthcare providers, and so we're trying to be better at that. That's something that we're really having a universal language of talking about suicide and bridging crisis services, especially, is what we're pushing toward. And so anyway, stay tuned. We'll get on another podcast when things start to emerge a little bit more. But I'm very excited for the direction that we're going in as an island community in terms of recognizing the need, recognizing that we have gaps. You're not going to be able to adjust something unless you recognize that there are challenges, and there are a lot of challenges for our community. And I think we did a decent job over the last year, but we also recognize that there were a lot of people who needed help, and people were coming. Guam Behavioral Health was open, and there were people constantly showing up at the door or calling in and needing help and assistance. And so, we want to make sure we're doing our best also.
So just kind of moving on to your sort of personal history. So you kind of mentioned that before, right, that you had a postpartum mood disorder. Did you want to kind of talk about that a little bit?
Yeah. Okay. So, so I mentioned it earlier, just in this conversation, that, I was at the university, basically in my dream job, I'd say. In my second year, third year, of being full-time, I got pregnant. And planned pregnancy, I guess, and I was very, healthy pregnancy. Everything was fine. I gave birth in September 11. My son Orion was born. We actually did. So my birth was difficult. I gave birth at Sagwa, but Orion had to be rushed to GMH because he was in distress. And I stayed at Sagwa, because I was, so they rushed him. His dad followed him, and I was at Sagwa by myself. Well, no, not by myself. My mom was there. She came in, but it's all this, kind of backtrack a little bit. So throughout my pregnancy, I was completely healthy, no problems. I was working out all the time, and not all, but at a good state. And so everyone was sharing with me, your pregnancy, your labor is going to be fine because you're doing all the things you need to be doing, yada, yada, yada. And of course, everything was fine until I delivered, right? And so completely, I was able to deliver completely naturally, which is also a blessing. But, again, Orion went to the hospital, so didn't meet him and hold him until about 24 hours after. So luckily I was able to, go. I was released. I ended up being fine. But that was a real traumatic experience. And then it got coupled with a lot so of course, he was separated from me. And so the whole golden hour that's supposed to be experienced post delivery and feeding and all that stuff didn't happen. Mm-hmm. And so, I missed that. And he drank formula, which, as I didn't think I was as attached to this issue until, until I was, sitting there still hurting from my labor. And there's someone telling me about all the benefits of milk bearing and how I needed to feel better at Sagwa. I needed to feel better at the birthing center so that I could go basically feed my son. And I'm like, well, he's eating something. But from there, I just had this real weight of shoot, I need, I'm the mother. First of all, I was separated for 24 hours. Now I need to be able to produce this be able to feed my kid. So from that point, I was extremely adamant about breastfeeding solely, 100%. But I also wasn't producing anything. And my husband knew that he would drink the milk, the formula, because he had to drink the formula in his early hours. And so I came home, we came home and we did all the things that I guess new parents do, but I was extremely exhausted because I was forcing myself to try to feed my kid. And I wasn't sleeping, and I was really just trying to do all the things that I thought I could do as a new mom. And I remember going my first visit. The first time I went out of the house by myself, like I think I ran to Ross to get something, right? And not really run, but this must have been 2 weeks postpartum. And I went to Ross to pick something up, and I ran into a girl, someone I knew, and she was, asking me, she's like, "Wow, you congratulating me and all that stuff." And I said, "My gosh, I never knew I'd feel like Superwoman. This is exactly," and when I think about it in retrospect, I'm like, oh my God, those were like early stages of psychosis. I mean, these were all the signs that were coming out. And so, I was very open and expressive that, I feel like Superwoman. I can do everything that I need to do. I'm so on top of everything. I would come home, all the laundry's done, and so I was like that for about 3 weeks, where I was just feeling like on top of the world with zero sleep. When it really I guess my husband really noticed that, he would try to tell me to go to sleep, but is when I don't know if you guys have an everything drawer at your house, the drawer that you just throw whatever random stuff in. I was up, they were sleeping, my husband and my son were sleeping, and I organized the crap out of this drawer. Like the pens were all in, it was like, I have a picture on my phone to remind me of that experience, because it was like, after it was done, I was so proud of myself. And when I look at now, I'm like, oh my gosh, these were all, again, signs that there was something going on. And so finally so it was about a month later, or about a month into my postpartum, I was hearing things, I was seeing things, I was continued to say that I could do everything I needed to do, but I wasn't sleeping. And then I kind of took one of my girlfriends picked me up to run a couple errands, and she's like, "Come, let's go." And when we were in the car, I really like just unfolded, and she had to call, we went back to my house, and she had to tell him, like, something's going on, like she's not herself, like. So it was this whole thing. My family my family and my closest friends kind of staged a little, I don't know if it's an intervention, but just basically said, we need to do something. And we want you to be okay with us doing something. We don't want you to feel like you're doing things against your will. So the next day, we went to Sagua, and from there I was actually admitted into Guam Behavioral Health for postpartum psychosis and postpartum depression. I was in there for about a week without, again, not being able to breastfeed, obviously, not being able to see my son. Probably the loneliest, but also the most necessary time in my whole life. And I didn't think, I talk about this fairly often, so I didn't think I'd get a little bit emotional, but I think the whole thing, it wasn't so much as being there, it was the after that really just made me really think about, okay, now I am, so I wasn't working at Guam Behavioral all the time, right? So, but I did know, you don't really see the people who, I did have a relationship with Guam Behavioral, right? So I would do some work for them, and I was contracted to do some work with them. I knew a lot of people who worked there. But not in the unit, that's nurses that you don't really see outside. So I grew so much respect for everyone who worked there while I was there. I felt like I got such good care while I was in the unit. But my lesson learned, or my takeaway after the whole experience, was that it was really, really scary to go back into that space. So, after I was released and I felt good again, I had to do a month after, I think I had to go back for like a follow-up appointment. And I remember sitting there, waiting for the doctor, and, kind of checking in with the nurse. and there was someone sitting next to me, and she was on her phone, and she was an employee, but on her phone while I was sitting there checking in. And I just remember feeling like she's telling her friends that Dr. Whitman is here, or she's telling people that she's here and she went cuckoo, like that was the narrative that I imagined, again, is in my head. And I think that's why I try to be as open and as honest about what happened, because I don't want anyone to feel like people are going to go and talk badly about them getting experience, getting the services that they need. I feel very fortunate. My son's happy and healthy, and I happy and healthy. And sorry, gosh. But it's really, I think that was the biggest thing for me, was that knowing that I was, for someone who preaches like not promoting stigma, negative stigma on mental health, I felt like it was really, really hard for me to re-enter that space as a professional again, because I felt like I was going to be judged. And I was like, gosh, man, if I feel this way, imagine everyone else, right? So I think that's been my reason for kind of like trying to talk more and more about it and being as honest as I can without it being like the thing that I always want to talk about, because I don't always want to talk about it. It definitely was a hard time that I don't want to revisit every year, but I think it's an important part of my narrative. And so with that said, I went back, so I got the help I needed. I was doing active therapy. I was really good about using the medication. I was really worried about not being attached to my son. I'm as attached as ever to my son. So, I'm able to function in the world, with the resources and support. I think I'll always say I'm in recovery, to be honest. I'm scared of having another child because I don't know what might happen. But, that's part of the process, right? And so knowing that there's always going to be active work, that you're doing, and that's okay, and so I think I'm very, and that was, again, a fear. I was, gosh, man, if people know that I'm in active recovery, or, that I spent time here, are they going to trust me as a professional? Are they going to believe that I'm still competent in the work I do? So I was questioning a lot. I was still teaching. So I went back to, that happened in the fall. And then I started teaching again in January, the spring semester. And then COVID happened, the pandemic occurred, and I was working from home. And that's kind of where I was like, you know what, I just feel like I need to do something else for a little bit. I need to be closer to, not that you're not close to the pulse of the field at the university, because you're training the counselors, but I felt like I needed to be in the system somehow. I felt like I needed to be the one to say, it's not okay to sit there and be texting while a client is checking in for their appointment. I feel like I want to be there to say, it's not okay that we're kind of losing contact of people who are going from the ER to our system, and I felt like I've been able to have a decent, impact, I guess. And so one of the things that I'm really happy about is that in the last 6 months that I've been at Guam Behavioral Health, there was already a group that was really pushing for this, but I was able to really be sort of accountable for the hotline becoming the National Suicide Prevention Lifeline, or, kind of interacting with each other. So now when people call that 1-800 number that's publicized so much, and that people from Guam call often, now they're connected to local resources and services. And that's one of the things I'm like, oh gosh, wow. So when we talk about the crisis continuum services, that's my big, I'm so happy of the team that band together to make that happen. And we can put that kind of on our, even if our names aren't attached to it, we know that was a lot of the work that we did and a lot of the time we put in. And so for me, that was a very worthwhile, my move was worth it for a while, and I don't know how long I'm going to be in this space. But I'm confident that this is the space that I need to be in right now. Yeah, so that's where I am. I think my plug for that is that, parenting, I mean, I don't know, I know, Roselle, you're a parent, but, it was a huge life change for me, or shift in my life. And I'm very fortunate that I had the access to the resources and supports that I needed. and even at that, it was hard as hell, like even at that.
Right.
So I guess I always think about other people who are going through difficult situations with limited resources and limited access, and how much more difficult it would be for them. So that's my that's my little spiel about my motherhood experience and my personal experience with mental health services. I mean, I've always, and I think I've shared this, I've always been a believer in counseling, though. So that's not my first experience. I was always, since I went to college and was able to access counseling services from the school, I was always actively receiving therapy. And so that part, that needing, I think the difference with this is that the other times it was initiated by me, and this time it was like, you need to go and we need to intervene, and this is about safety. It's not just about like well-being and overall holistic, it was really it was a need. It was a need, and someone had to point that out to me, like we needed this to happen. So it was, again, and I think an important reminder that, we have to really, our natural supports need to know what services are available, so that if they do know if someone is in need of something, then they know where to go. And that's that.
Thank you so much for sharing. This entire story is just so powerful for a lot of reasons, like not just because you're a mental health professional, right? But like, first of all, the fact that your loved ones knew when it was time to intervene, and they helped you to make those first steps to getting yourself help. That's amazing to me, because not everybody would know that this is something that you do. So like that, just sorry, my mind is like, being blown away. I mean, like, obviously, like, I understand this experience, right? Because, my mom has been diagnosed with bipolar disorder and OCD. So like, we've had to like help her get treated in the past, but like to hear the story from somebody else is always, so interesting to me, because it makes me feel better about like, where people are, and their support systems. Second, like, I really hope that like you feel good about your choice to share this story, because I think it's like really important for people to understand that like everybody's human. You are human. You understand what it means when somebody else needs help. And I feel like that makes you just so much more accessible for other people, that you know what you're talking about, that you understand what it means to have to get treated, have to get help, and to navigate those channels to get yourself into a place where you're in a better headspace and, continue your day. Because like, like I said, there's this whole stigma that like people are not qualified to walk amongst other people if they have to go through any kind of mental illness or any kind of disorder. And that's just like not true. We know that that's not true, but not everybody knows that's not true. So like, I hope that you give yourself all the credit for sharing this, because that's so important. Just because that you had, these experiences does not make you less than of a mental health professional. I think that makes you even more powerful as a mental health professional, because then you can speak to your own experiences. You can, where,
I appreciate that.
People need, the system needs help, where, like, what you can do better, like, and you are in the perfect position, I feel like, to make those changes,
Yeah, thank you. I really do appreciate that, because it is, again, one of the things, like, I think when people have like kind of lived experience, and this, I think, if anything, it has showed me, not that, when you are a counselor or in the field, you naturally have empathy, right? Or at least that's what I hope, if you enter that kind of field, you should, be naturally empathic and, and be able to kind of be with and be present with an individual. But absolutely, it doesn't, when you have that real strong, intense experience, it does put more personal, I think, there's a more personal investment in needing to be present for the people you're serving. It's like a higher power has taken over whatever it is, has drawn you to say, this is what you need to be doing, or this is not, because this could have been you, or, you could have been, in that position in some way. So yeah, it definitely does connect me to the field more. And again, that's, I think, why I was led to like making that shift, even though it wasn't, it's not like I'm working with mothers right now, not directly or anything like that, but I just knew I needed to be, again, closer to the pulse, I think, of what was like more direct services, even though it's not really direct services, but yeah, if that makes any sense. I needed to be a part of that. And I feel very fortunate. Again, it's a weird thing. It was a weird time for me to make a job change because it was in the middle of a pandemic, and so I feel very fortunate though to have been in where I was during that, at Guam Behavioral Health, and kind of understanding what was going on, and a part of the crisis services that needed to occur and that are still occurring, in this year. So I don't know, it leaves me very hopeful for the state of mental health services, formal services and informal community support. So that's my positive thing. I feel good about the direction our community is heading with regards to mental health.
Right, and thank you again for everything you have shared today. There has been a wealth of information just from learning about your professional and your personal life, and so we really appreciate your expertise and your vulnerability. Like Roselle said earlier, it's just so powerful to hear these stories, and there's just so much power in storytelling, and again, just so grateful to have you here. Before we wrap up for today, is there anything you want to share? I know safe messaging, we always want to end on a hopeful note. So yes. Good job,
CJ. See, I've done my job. Yeah. I think it's just, I think, I don't know what my message would be. I've never felt like I think it's just, take care of yourself, whatever that looks like. I think it's just important to take care of yourself. And on the other end, be kind, you never know who you're impacting by just smiling or, doing a nice little gesture, or, not being rude. Right. So, I think, that would be kind of the last thing I might say is, take care of yourself. It's been a rough year. But I think we're learning new strategies for being, learning how to take care of ourselves. And, and I guess the other thing is, I think a lot of people think that they need to things like wellness or, mental health is supposed to be this magical thing that comes to you, it takes work. It takes time to meditate. It takes work, and you might not get it right away. And it takes time to go to therapy. It takes resources and money, and you might not like it right away. You might not even fit with your counselor immediately. Right. So, it does take work but I think if you're able to, again, succumb or, kind of let go and be vulnerable in those yucky moments in the beginning, then a lot of good can come out of it. At the, the outcome is positive. It can be positive, but it's not going to be immediate changes we won't see. And so I think that would be my other thing.
Thank you.
You're welcome.
Thank you so much for sharing. Thank you so much for sitting down and talking with us. I think this has been a really great discussion, and I hope that I'm sure it will be really helpful for somebody else who might be struggling. So thank you again for joining us, and thank you so much everybody for tuning in. We'll see you. You'll hear us next time.
Special thanks to Andrew Speed for sound editing, mixing, and creating our intro music. In honor of Mental Health Awareness Month, new episodes of Everything's Cherry will be available every Wednesday for the entire month of May. Please be sure to tune in and listen or find our visual podcasts available on YouTube. Don't forget to find and follow us on Instagram at @everything'scherryguam. If you are interested in being a guest on the show, send us a DM or email us at cherrygupodcast@gmail.com. Our aim with this podcast is to have important conversations about mental health, but we understand that the feelings brought upon this exploration may sometimes linger. If you are looking for support and healing surrounding your experiences, the following resources are available and accessible for you. The Guam Behavioral Health and Wellness Center 24-hour crisis helpline can be reached at 671-647-8833. And the National Suicide Prevention Lifeline is 1-800-273-TALK. That's 1-800-273-8255. Thanks for tuning in, and we'll see you next time.